You know what the number one thing that surprised me when I became the prednisone pharmacist is? Joint pain after taking prednisone. I literally had no idea. I swear they never taught that in pharmacy school. They never mentioned, hey, by the way, when somebody's going slowly off prednisone, they might get joint pain. And I was shocked that people get joint pain after taking prednisone. And then I was participated in Facebook support groups, and I swear I saw somebody every day. Hey, I'm having this terrible muscle joint pain. Are you guys having that? Every day somebody was saying it. And then I realized that's what people have. So if you're having joint pain after prednisone, there's a couple things that could be going on. First of all, and this is probably not likely for most people, but if you are taking prednisone for rheumatoid arthritis, it could be that your rheumatoid arthritis is flaring. And so your joint pain is your rheumatoid arthritis coming back. But that's only if you're taking it for rheumatoid arthritis or another joint condition. Most people on prednisone are taking it for something else. Like I took it for a bleeding disorder. And other people take it for lupus or for cancer or tons of different reasons. And so I had a paying client call me today and say, hey, I'm having this terrible, terrible joint pain. I can't even get up out of bed in the morning. I feel tired all the time. What is going on? And I said, well, it sounds like you probably went way too fast off of the prednisone. You probably are experiencing prednisone withdrawal syndrome. You're probably having a terrible, miserable side effect of going off too quickly. And so people who are on prednisone, you always have to taper off. You always have to go off slowly. And you have to make sure that when you're going off that you don't either go too fast because it makes your disease come back. Like for me, I would start bleeding again. Or for people with rheumatoid arthritis, their joints would start hurting again. So that's the number one reason you taper. And the second reason that you taper is so that when you are going off, it doesn't cause withdrawal syndrome like this. So basically, what is withdrawal syndrome? The number one thing people complain about is this achy, miserable feeling, kind of like you have the flu. You know, that feeling when you're stuck in bed and you just feel yucky, you don't have any energy, fatigue, and you might even have a fever. And all of this together shows that you're in withdrawal from prednisone. You didn't go off slow enough. And it's probably not your fault. Your doctor probably told you to go that fast. Like this lady, she went from 60 down to 40, down to 20, down to 10. That's what her doctor said to do. But from 20 to 10, you know what happened? The joint pain. But she said, but it's never happened before. Right. Even if you've been able to drop that quickly in the past, there's no predicting prednisone withdrawal. Even if you've been able to go completely off prednisone, withdrawal can still happen to anyone at any dose, at any length of time. You could be on it for 3 days and still get prednisone withdrawals. You could be on it at 100 milligrams. You could be on it at 5 milligrams and still get prednisone withdrawal. So why are you experiencing joint pain after taking prednisone or lowering dose after prednisone? It's because of prednisone withdrawal. So what can you do? Well, I gave this paying client a whole bunch of really helpful tips. But in summary, if you're going through withdrawal from pretty much any drug, what's the rational choice? It's to go back up. And she really didn't want to go back up. She'd worked so hard to get down and she didn't want to go back up. So we talked about a few other options. What have you experienced? Have you experienced prednisone joint pains after taking prednisone? Is this really such a common thing that that doctors and pharmacists should be warning about it? How often do people really experience it? Comment below what your personal experience is. And then if you, like this paying customer, would like to have a one-on-one prednisone side effect consultation with me, I will put a link below of my Calendly where you can schedule a one-on-one and we can talk side effect strategies. Signing off as Dr. Megan, your prednisone pharmacist.